Question here, the office nurse, while reviewing a client health information, noticed that the client has recently started taking the St. John's wort. So St. John's wort is a herbal medication or herbs. Sometimes St. John's wort our patient take it because of depression, right? So when we work in the psychiatry department, if we see any patient has taking the herbal medication, we must inform healthcare provider because so many herbal medication can interact with other drugs interaction. Sentence what used to treat the depression and anxiety. But it is very important patient education or teaching about this. Central word always interact with other antipsychotic like SSRI, or they can interact with monoamine oxide inhibitor. And central word also can cause sun sensitivity or decrease the effect of digoxin. It is very important for NCLEX board and it is the patient education. So what additional information most important for nurse to obtain about the St. John's wort and depression, because our patient are depressed. There are four options. Ask the client is currently taking any prescription antidepressant medication. Option one, right? As I told you, antidepressant and St. John's wort, when you take together, can cause a problem. So it is good not to take together, because when patient take these two medication, I mean St. John's wort and antidepressant, they cause the problem we call serotonin syndrome. So what additional information? Say what prescription antidepressant. So it is the contraindication. Never give monoamine oxide inhibitor and St. John's wort together. Or do not take St. John's wort with SSRI together, especially herbal medication like St. John's wort. If your patient take St. John's wort with SSRI or St. John's wort with monoamine oxide inhibitor together, both of them together, the risk for serotonin overload or serotonin syndrome. Question number two, option two, asks if the client has been diagnosed with depressed by a mental health care provider. There's so many reasons we do not like number two. Because a psychiatric patient, if you ask them, are you diagnosed with this or that, how they will respond? Because their brain is not work, they have a mistrust, right? Abnormal belief. How you can depends on their information. It is not professional. Ask if the client take a multivitamin with the iron. It is important, but not priority for this patient. Ask if the client use the tanning bed. Out of four, the most important here Ask the client currently taking any antidepressant as prescription because they can interact. So first of all, it is very important to know for NCLEX board about here SSRI. SSRI stands for selective serotonin reuptake inhibitor. And this medication help you to keep the serotonin in the body longer and which makes you happy. Because SSRI or monoamine oxide inhibitor are the psychiatric medication we use for as an anti or antidepressant. Our target keep the serotonin in the body longer, which makes us happy. Here's some clues how to remember. It is called effective for sadness, panic, and compulsion. Effective E stands for acetylophen or citalopam. F stands for fluoxetine, and sadness S stands for sertraline. P stands for paroxetine. Compulsion C stands for citalopam. So citalopam, acetylopam, fluoxetine, sertraline, or paroxetine are the example of selective serotonin reuptake inhibitor. So what we have to know for NCLEX board exam? This medication we use for antidepressant. It is psychiatric medication, but they have some side effect. Like, easy to remember, SSRI side effect is 1, 2, 3, 4. 4S. S stands for stomach upset. Second S stands for sexual dysfunction. Third one, serotonin syndrome. And last one, suicidal ideation. So SSRI causes the suicidal thoughts, especially in the children or adult. And it is important to educate your patient. SSRI may take up to 4 to 6 weeks to work. And when your patient take the SSRI, do not give with disulfur. And also it is good given this medication at the evening. And also it is good to avoid with alcohol. Okay. Keep in mind, all SSRI can cause serotonin syndrome or serotonin overload if too much of the drugs is given and never give with SSRI with St. John's wort, or never give SSRI with monoamine oxide inhibitor together. They can cause a crisis, and we call serotonin syndrome. That if our patient have a serotonin syndrome, what are the side effects occur, or what are the presentation of serotonin syndrome? Before to go serotonin syndrome, let me explain about the monoamine oxide inhibitor. It is also antidepressant, shortly called MAO-I inhibitor. And this medication helps you to keep norepinephrine or dopamine and serotonin in the body longer, which makes us happy. An easy way to remember the serotonin is called nardil, parnet, and morphine. The chemical name of nardil is called phenylzine, and chemical name of morphine is called isocarboxide, right? So what are the common side effects they can cause? Or also, what are the common side effects of serotonin uptake, SSRI? So common side effect for monoamine oxide inhibitor or SSRI, different way we can remember A, B, C, D, and S. A stand for alter vital sign. B stand for they cause sometimes bradycardia. They can cause convulsion, confusion, and also D stand for dizziness. S stand for stasis of urine, right? So what are the contraindication of monoamine oxide inhibitor? First one, never give with monoamine oxide inhibitor with SSRI. And also keep in mind, monoamine oxide inhibitor medication take 4 to 6 weeks to work as like SSRI. So when we give monoamine oxide inhibitor, educate your patient for some dietary restriction, like tyramine restricted food not to take with monoamine oxide inhibitor. So again, let me recap it about the monoamine oxide inhibitor. So some dietary restriction is important. Your client will not be allowed to eat anything with tyramine containing in it. Tyramine and taking monoamine inhibitor together can cause severe hypertension. So in this picture showing what are the signs and symptoms of the serotonin syndrome, mydriasis, means dilatation of the pupil, agitation, diaphoresis, excess sweating, tachycardia, or autonomic instability, hypertension, sometimes diarrhea, hyperactive bowel sound, or clonic involuntary movement or tremor. What else? About this question, now talk about little bit here. So sentence word is herbal product commonly used by many clients to treat the depression. However, it may interact with medication used to treat depression or other mood disorder, include TCA, means tricyclic antidepressant, or selective serotonin or norepinephrine receptor like SSRI or SNRI, and also monoamine oxide inhibitor. So taking St. John's wort with this medication tends to increase the side effect and could potentially lead to dangerous condition we call serotonin syndrome, right? So now here we go. Serotonin is a chemical product by the body that is needed for nerve cell and brain to function. Excess serotonin causes the symptom that can range from mild to moderate. If the mild patient is diaphoresis, means excessive sweating or diarrhea, when severe muscle rigidity, fever, or seizure. Sometimes some patients complain of headache or apprehensive, apprehensive. So severe serotonin syndrome can be fatal if it is not treated. Now what are the education objectives? St. John's wort interfered with many prescribed medication. It is priority for the nurse to assessment for concomitant use of St. John's wort with prescription like SSRI, monoamine oxide inhibitor, or tricyclic antidepressant. Such combination can cause the serotonin syndrome, right? So, like St. John's wort also inhibit the digoxin absorption.